My name is Sullivan. I'm an emergency physician in Syracuse, New York at the SUNY Upstate Emergency Department, and I'm also the director of the SUNY Upstate Opioid Bridge Clinic. This hospital, we see over 100,000 people in the ER. And the number of patients we've seen in our ER due to opioid-related problems have doubled, really, in the past 5 years. Couple that with a rate of, in 2016, about 200 people dead in our county. And what I realized was that what we were doing was not working. There had to be a different way to help these people, to make them safer, to make them healthier. And what we're doing now is we've started a comprehensive program, a clinic, a bridge clinic. So what we do in the bridge clinic is that we bridge that gap. Patients who come into our emergency department, particularly after an opioid overdose or in withdrawal, we give them a dose of buprenorphine. They get a single dose in the ER, and then within 3 to 5 days, they follow up in a clinic that we've established. And there they see myself and actually a peer. And a peer is a peer specialist. These are people who are also many years in recovery themselves, but are also specialists in social sciences. They might be social workers, they might be case managers. And together, we also help plug the people into the social services they need, whether it's helping them get housing, whether it's getting them insurance, food stamps if they need it. These things all have to also happen at the same time before we can even think about them doing all the work they need to do to try to conquer their drug addiction. We are now seeing about 60 patients a month. We've seen now in the 2 years over 300 patients. Those are people who would not have gotten help. Those are people who would not be in treatment. Of the people who come to our clinic, about 80% of them we successfully link to treatment. We actually decrease emergency room visits by about 40 to 50%. On 1 month follow-up, about 75 to 80% of them are successfully still there 1 month later, now getting buprenorphine or methadone or some other type of treatment.
I started here 4 months ago, so about 3 months I haven't touched opiates since I started here. I mean, I've been to 5, 6 different rehabs and none of them worked. Inpatient rehabs, long-term and short-term, and none of it worked. It's been helpful for me because before I came here I was an opiate addict, and since I've been here I've been off of opiates, more focused on my treatment, set it my next fix.
The most rewarding thing about this work really is, when a patient really thanks you. And they can look you in the eyes and tell you about how their life has changed. I know it's kind of cliche, we talk about that a lot in emergency medicine, but our job is people in, people out. And we get by assuming and hoping that everybody does well. But to really see the fruits of your labor, to really see somebody be a productive member of society is the most rewarding thing that I've ever experienced.